neurons, also called alpha motor neurons. That will make sense later because you're going to find that we actually have two types of lower motor neurons. The ones you know about, which are also called alpha motor neurons, and a different type of motor neuron that doesn't control the muscle fibers that contract. They control a different type of muscle fiber that keeps the muscle spindles sensitive to changes in muscle length. It's okay if that made no sense. It will when we get to chapter 13, part 2. But we're going to distinguish between alpha motor neurons and gamma motor neurons. Regular old lower motor neurons are also called alpha. Fibers innervating muscles of the back pass through the dorsal ramus. Fibers innervating muscles of the ventral body wall, lateral body wall, upper limbs or lower limbs pass through the ventral ramus. Axons of preganglionic sympathetic motor neurons form the white ramus and pass through it before synapsing at the sympathetic ganglia. So here's a recap. If we look at somatic, which is red, here's your somatic motor nucleus. This alpha motor neuron, aka lower motor neuron, will have to pass through the dorsal ramus in order to innervate a muscle of the back. Right? So muscles of the dorsal body wall would include erector spinae group, rhomboids, latissimus dorsi. But if you're innervating a muscle on the lateral body wall, obliques, ventral body wall, rectus abdominis, lower limbs, upper limbs, you're going to pass through the ventral ramus. Right? In other words, if we're looking at the body below the head and neck, because we know the head and neck's taken care of by cranial nerves, and we're focusing on spinal nerves right now. So if you take the whole body, anywhere that you need to reach skeletal muscles, you're going to pass through the ventral ramus unless those skeletal muscles are on your back. If they're in the dorsal body wall, you go through the dorsal ramus to get there. Otherwise, ventral ramus. Lower limbs, upper limbs, lateral body wall, ventral body wall. You go through the ventral ramus. Notice there's no red going through rami communicantes. That's because this pathway takes you into the ventral body cavity. What skeletal muscles do we have inside of the ventral body cavity? There's one, and only one, the diaphragm. And it already has its own designated nerve. What's that nerve called? Phrenic nerve. So there's no reason for any somatic efferents to go into the ventral body cavity, aside from the phrenic, which takes care of the diaphragm. But inside the ventral body cavity is all your viscera, all those visceral organs. And they're controlled by autonomic efferents, which is why you see blue going all the way through. And black. And the difference is the blue is the preganglionic, and the black is the postganglionic. In chapter 14, we'll look at these pre- and postganglionics a little more carefully. Okay, for now, we'll just keep it kind of basic. This is not a unipolar neuron, by the way. Someone asked that in a previous class, and it's a great question. All these motor neurons are multipolar. The reason it looks like this is because they're showing you the possible options. From the cell body, the axon of this multipolar neuron could head straight out through a sympathetic nerve to reach a visceral organ. Or the axon could go the opposite direction. It could go back through rami communicantes by passing through the gray ramus, all the way up to the spinal nerve, and then from there, go through the dorsal ramus to reach the back, or the ventral ramus to reach anything else. Now obviously there's no cardiac muscle out there, but there are glands, sweat glands. There is smooth muscle, blood vessels, and those are controlled by autonomic efferents. So if we need to innervate smooth muscle in blood vessels that are in the latissimus dorsi, you're going to have to go through the dorsal ramus to get there. And then the lower motor neurons that actually innervate latissimus dorsi, they would also have to go through the dorsal ramus to reach the muscles of the back. Axons of some of the postganglionic sympathetic motor neurons form the gray ramus before extending into the ventral or dorsal ramus. And that's what I was just pointing out. So here's your preganglionic cell body. Axon goes through the ventral root, through the spinal nerve, through the white ramus, and synapses on the cell body of the postganglionic autonomic neuron in the autonomic ganglion. And that's what we've been calling this so far, autonomic ganglion. But we can be more specific. This is just outside of the thoracic cord. There's no parasympathetic, it's only sympathetic. So rather than calling this an autonomic ganglion, we can more specifically call it a sympathetic ganglion. You wouldn't be wrong to call it autonomic, but we can be more specific. So you have three options. After the preganglionic synapses on the post, if we need to reach the heart or smooth muscle in the gut, we have to go into the ventral body cavity. So we'll continue in this direction through the sympathetic nerve to reach that structure. But if we need to reach a sweat gland in the lower limb or upper limb, how are we going to get there? The postganglionic axon is going to go backwards, back through rami communicantes, but it's not going to go through the white ramus, it's going to go through the gray ramus. And then if we're getting to upper limbs, lower limbs, ventral ramus. Or what if we're innervating a sweat gland in the back? Dorsal ramus, right? Option 1, option 2, option 3. Just depends on where we're trying to go. So definitely not a unipolar neuron. They're just showing you different options. The difference between white and gray. Preganglionic sympathetic neurons, type B, myelinated, white ramus. Postganglionic sympathetic neurons, type C, unmyelinated, gray matter, gray ramus. That's the difference. Myelinated, unmyelinated. Gray versus white. Note, ventral and dorsal rami contain axons of alpha motor neurons and postganglionic sympathetic neurons destined for similar body regions. Ventral ramus and dorsal ramus. You'll find both somatic and autonomic efferents headed to the same area of the body. Right, so really it's just distinguishing between the dorsal body wall, in which case you go through the dorsal ramus, versus any other part of the body, in which case you go through the ventral ramus. And they don't really make this clear, but the ventral ramus is much bigger than the dorsal, which makes sense, because the dorsal only serves the back. Ventral serves everything else. The size is about right on here. So these two sticking up here, this is a broken model, those are rami communicantes. This is better. So here's dorsal root, ventral root. Spinal nerve is just this little piece here. And then you have your branches. These two, rami communicantes coming down. This big one, ventral ramus. And this small one at the top, dorsal ramus. So this does a better job of showing you the size difference between ventral and dorsal. Note B, ventral rami at the thoracic level travel anteriorly as the intercostal nerves. Everywhere else, you have ventral rami mixing together, forming plexuses, cervical plexus, brachial, lumbar, sacral. But in the thoracic region, the ventral rami remain isolated from each other. They don't mix together in any way. So each ventral ramus forms a single intercostal nerve. That's what they're saying here. Note C. White and gray rami together form rami communicantes. And now you know why the white is white and the gray is gray. So now we look at the same image, but with all the motor removed, and now focusing just on sensory. So this is all afferent now. Number 1, dorsal root contains axons of somatic sensory neurons and visceral sensory neurons. Their cell bodies are located in the DRG. Dorsal root has red and blue. Red represents what? Somatic sensory, and blue, visceral sensory. Here's your somatic sensory nucleus, visceral sensory nucleus. And here in your lateral horn is the visceral motor nucleus, and then in the ventral horn is somatic motor nucleus. So somatic is top and bottom, and visceral is kind of in the middle. Visceral sensory, visceral motor.
For the dorsal ganglia, those are not unipolar too, right?
These are, yeah.
Oh, they are?
Mm-hmm.
Okay.
Those aren't showing you options, that's actually what it looks like. Right? Peripheral process comes in, body is in the DRG, central process goes into the cord. Number 2, visceral afferent fibers innervating interoceptors of the back, and somatic afferent fibers innervating exteroceptors of the back pass through the dorsal ramus, followed by the spinal nerve before entering the dorsal root. So we're focusing on the back, right? The posterior body wall. So interoceptors from blood vessels, exteroceptors from the skin, proprioceptors from the muscles. All of that information coming from the posterior body wall comes in through the dorsal ramus. So it's a mixture of both somatic and visceral. Through the spinal nerve, and technically the spinal nerve is just this long, just this little piece here. And then through the dorsal root to get into the dorsal horn. Number 3, visceral afferent fibers innervating interoceptors of the ventral body wall or lateral body wall or limbs, and somatic afferent fibers innervating exteroceptors and proprioceptors of the same locations, ventral body wall, lateral body wall, limbs, pass through the ventral ramus, followed by the spinal nerve before entering the dorsal root. Okay, so we're looking at ventral body wall, lateral body wall, lower limbs, upper limbs. If it's somatic, it's coming from exteroceptors or proprioceptors. Visceral, coming from interoceptors. But they all pass through the ventral ramus, spinal nerve, dorsal root, to get into the dorsal horn. Number 4, visceral afferent fibers innervating interoceptors of the visceral organs pass through the white ramus before joining the other afferent fibers at the spinal nerve. Notice there's no red in here. There is no somatic sensory information coming from within the ventral body cavity. Right? Because that's all organs in there. That's all your viscera. And unless it's pain or pressure, we don't feel it. We don't detect it. So from interoceptors, visceral sensory information comes through rami communicantes, spinal nerve, dorsal root, dorsal horn. When it passes through rami communicantes, it actually goes through the white ramus. And while this afferent is coming in the white ramus in this direction, what's going out this direction? The preganglionic sympathetic efferents. Number 5, notes the ventral and dorsal rami contain axons of somatic sensory neurons and visceral sensory neurons that innervate receptors in similar body regions. So while you only have blue, visceral, going through rami communicantes, you have a mixture of both somatic and visceral coming in through the dorsal ramus and the ventral ramus. Ventral rootlets, ventral root, dorsal rootlets, dorsal root, dorsal root ganglion. Dorsal root, ventral root fuse together to form spinal nerve. Spinal nerve then branches. This is rami communicantes. This is dorsal ramus. And this is ventral ramus. And if you have somatic efferents passing through the ventral ramus, well, where are they headed? What parts of the body can they reach by passing through the ventral ramus? They could be innervating skeletal muscles in the lower limbs, ventral body wall, upper limbs, lateral body wall. Essentially everything below the neck except the back, the dorsal body wall or posterior body wall. How about visceral motor passing through rami communicantes? Where is that headed? The organs within the ventral body cavity. Right? So the walls, ventral, lateral, posterior, surround the ventral body cavity. But if you need to go in the cavity to innervate visceral organs, you're going to pass through rami communicantes. If you're just going to the wall itself, dorsal ramus or ventral ramus. Nerve plexuses. So this is looking at the spinal nerve distribution at the cervical, lumbar, and sacral regions. Because here the ventral rami mix together. Cervical plexus. You do need to know which ventral rami fuse to form each plexus. And for the cervical plexus, that's C1 to C5. Ventral rami from spinal cord segments C1 through C5, all mixed together, as you can see here, and form a plexus, the cervical plexus. And from that plexus, there are many nerves that originate. The only one you need to know is phrenic. Brachial plexus. Ventral rami of spinal nerve C5 through T1. The nerves you need to know from this plexus: musculocutaneous, median, ulnar, radial. You don't need to know specifically what structures each one of those nerves innervate, although you may remember from chapter 10, because it was on the muscle list. What you do need to know is body region in general. So for the brachial plexus, you need to know that all the nerves that come off this plexus innervate muscles and skin of the upper limbs and pectoral girdle, rather than naming all the muscles, just upper limbs, pectoral girdle. Lumbar plexus. Ventral rami from T12 to L4 fuse together to form the lumbar plexus. Innervates muscles and skin of anterior lower limbs, lower abdomen, genitals. Then the nerve you need to know, femoral. Femoral is a large nerve that passes anterior to the hip and runs through the anterior thigh, which should remind you that this plexus innervates muscles and skin of the anterior lower limb. How about posterior lower limb? Sacral plexus. L4 to S4, ventral rami, form the sacral plexus. Collectively, the nerves from this plexus innervate muscles and skin of the posterior lower limbs, buttocks, and genitals. You need to know the sciatic nerve. And the sciatic nerve itself is actually a composite nerve, very similar to vestibulocochlear cranial nerve. It's two nerves fused together, although in some people, it actually, they remain separate. Some people don't have a true sciatic nerve. They just have the tibial nerve and the common fibula running together all the way up into the sacral plexus. So if it's bundled together, it's going to look like this. One big nerve called sciatic. But sometimes you see this. The two running together, but you can see it's two distinct nerves. Together called sciatic, but separately it's tibial, common fib. Now where they typically separate is behind and above the knee. What looks like a continuation of sciatic is tibial. So sciatic is going right down the middle of the posterior lower limb, and that's exactly what tibial does. And of course, it's named after the tibia, which is the central bone, right down the middle of the leg. And then the branch that goes off to the side, it's headed to the lateral leg, right? And the lateral leg bone is fibula, so it's called common fibular or common peroneal. Peroneal is a regional name for the lateral leg. Either is fine. As far as models for the peripheral nervous system, brachial plexus, and then the 4 nerves that come off of it. And we can see a little bit of musculocutaneous coming out here. To see the others, you really need to pull all the muscles off. But on the thumb side, you'll find radial, and on the pinky side, ulnar, and right in the middle will be median. And then on the lower limb model, you can see sacral plexus. And then if we take the butt off, you can see the sciatic coming down. And if you take the other muscles off, especially down here, you can see common fib wrapping around the knee to the outside and tibial headed straight down. And then in the front, running right between psoas major and iliacus, you can actually see femoral nerve. The lumbar plexus is up here, so you're not going to see that, but you can see the main nerve coming off of it. And then the 2 models back here show pretty much everything. So this one's got brachial plexus, cervical plexus, lumbar plexus, sacral plexus. You can't see any of the branches off the brachial plexus. You would have to use this model to see like radial and ulnar, median, musculocutaneous. Intercostal nerves. Remember, that's what the ventral rami from the thoracic cord segments, what they form. Intercostal nerves. And then down here, lumbar plexus, sacral plexus. Right here, running down the iliacus, or on this side between psoas major and iliacus, femoral. So remember, femoral is large, not as large as sciatic, but it's big. But it runs anterior to the hip. Sciatic runs posterior to the hip. And you can see the sacral plexus in the very beginning of the sciatic. And then all of those can be seen here. Cervical, brachial, lumbar, sacral, the 4 nerves off the brachial, the phrenic, little piece of it here, off the cervical, femoral, off of the lumbar. Great, that's sciatic. Here it is, femoral here, going right in front of the hip joint, and then sciatic going behind the hip. And if you follow it down, you can see where the common fibular branches off and goes around the leg, and the tibial continues down right behind the tibia. So those 4 models, the 2 green boards, the 2 lemons. We are done.